afternoon, good evening, good morning. Welcome, welcome everyone for joining us for yet another session on temperature-related illnesses and mortality. This is going to be a good session. Thank you for joining us. And we'd like to welcome everyone that we are seeing all over the globe. Welcome, welcome. I would just like to acknowledge my partners, Colombia, the Global Consortium of Climate and Health Education, who would be with us today, my own organization, EarthMedic, EarthNurse, PAHO, UE, and CIMH, the Caribbean Institute for Meteorology and Hydrology. Just to remind you that today we have live. You can choose your language in English or Spanish. We have live interpretation. You just need to select the button below to select which language you would like to hear the presentation in. And to remind you that this is the 4th session. However, we have many other sessions coming and we will keep you posted. Just make sure that you join our WhatsApp group so you're always in tune and always informed. So our learning objectives for today would be to identify current and projected changes to temperature and risk of extreme heat events in the Caribbean, and to define heat-sensitive health conditions and to cite examples of ways in which heat impacts the pathophysiology of cardiovascular, renal, respiratory, neurological, and maternal diseases, and to identify medical diagnoses, medication, and other health determinants that make patients more vulnerable to climate-related health impacts and threats, and that step up health professionals, and that steps health professionals can take to reduce risk. Also, to explain how extreme heat may exacerbate mental health burdens. And lastly, to explore the role of heat in early warning systems and other measures in preventing negative health outcomes. Just to remind you that this is a 90-minute session and it includes an expert lecture and 2 case presentations today. Sessions will culminate with a question and answer period. And please post your questions in the Q&A. All sessions will be recorded and posted on the webinar within 24 hours. Reference material and slide decks would also be included on the website. Participants who attend 70% of the live Zoom sessions and pass the final exam with a score of 70% at the end of the course will be awarded a certificate for participation in climate and health from EarthMedic, EarthNurse, and the Global Consortium for Climate and Health Education. Participants must, however, join each class session using their personal unique Zoom links and complete the final exam using the email address used to initially register for the course. Attendance will automatically be recorded during the live Zoom sessions. The exam link will be sent on the final day of class via email and will remain open for 48 hours. Certificates will be awarded on May 9th, 2024. And this is to remind you that if you want to get your CME credits, you must fill out this link at the end of the survey, the post-survey link. The link for the CMEs would be embedded in that link, and you must fill that out if you want CMEs. That link, which will be posted in the chat, would remain live for 2 hours after the close of the session. The CME credits are free, and they're recognized by organizations within the CARICOM region. And you will get 1 CME credit for each session that you attend in person. And this is just to remind you of our exciting team of presenters that we have here today: Dr. Pablo Mendez, Lazaro, Shanice Bedward-Grant, Neoni Winchester, Dr. Neoni Winchester, and Dr. Lindonne Telesford. And so I will tell you a little bit more about each of them right now. So our first speaker would be Dr. Pablo Mendez Lazaro, an associate professor in the Environmental Health Department, Graduate School of Public Health, University of Puerto Rico. A PhD in environmental sciences, he brings great diversity to the table. A visionary who has been working in the field of climate change, an extreme weather event, since graduating from the University of South Florida College of Marine Science, the San Juan Bay Estuary Program in Puerto Rico. He has formulated and implemented programmatic plans for climate change and research, addressing analytic needs and issues that emphasize science, equality, and integrity. He is recognized regionally and internationally as an interdisciplinary expert in climate change, equitable climate adaptations, and social ecological system. He wears several hats. A mentor par excellence, leading and guiding at all levels, including the Expert Advisory Committee on Climate Change for the government in Puerto Rico. He's here today to continue that mission as he shares his research, insights, and passion. It is indeed an honor and a privilege to have you, Dr. Lazaro, as part of our expert panel. Welcome. And then I'm going to go ahead and introduce all the presenters, and then we will then you would present. So our next presenter on the panel is Shanice Bedward-Grant. She is the National Coordinator of the Jamaica Building Climate Resilience of Urban Systems through ecosystems-based adaptations in Latin America and Caribbean. Working in the environment management field, experience in monitoring and evaluation, and skilled in project management, climatology, climate change, and agrometeorology. A strong community and social service professional with an MS in natural resources and environmental management. She is currently pursuing a Master of Philosophy, focusing in sustainable development with the University of the West Indies, Mona. Welcome, Shanice. And then I would like to introduce Dr. Neoni Winchester. Dr. Winchester is a clinical instructor with the Department of Large Animal Medicine and Surgery at St. George's University, Grenada. She's passionate about small ruminant production, reproduction and facility, as well as assisted breeding techniques. Prior to St. George's University, Dr. Winchester held the position of veterinary scientist at Cardi, where she applied her expertise to focus on regional food security. As a veterinarian, she diligently provides ambulatory and consultancy service to farmers to improve their profitability of their livestock production systems. Her graduate research focuses on the water intake behavior in pregnant ewes. Welcome, Dr. Winchester. And then we have Dr. Lindonne Telesford. Dr. Lindonne Telesford was awarded Doctor of Public Health by Walden University in 2018. She's an assistant professor in the Department of Public Health and Preventive Medicine at St. George's University in Grenada. For over 10 years, Dr. Telesford worked in public and private organizations in Grenada and later in several other Caribbean countries. At St. George's University, her project research and teaching activities are primarily centered on environmental and global health. Dr. Telesford is currently leading the development of wastewater recycling project in Grenada. She has co-authored her book, Public Health Themes in Grenada and the Caribbean region. One of her most outstanding work was conducting the first study in Grenada to estimate the prevalence of burden of foodborne diseases, for which she was awarded a Leaders Award from the International Conference on Emerging Infectious Disease Center of Disease Control. Welcome, Dr. Telesford. So we have this we are waiting a very exciting panel here to address us. And so take it away, Dr. Pablo Mendez, your first speaker.
Can you hear me?
Thank you, Doc.
Can you hear me? Yes?
Yes, we can hear you
Okay,
clearly.
perfect. So, wow, amazing. Thank you for that introduction, Paula. I feel very honored being here. It's a pleasure. Thank you for inviting me. And I will start sharing my screen. Please let me know as soon as you can see it. Okay.
Interior.
Okay, perfect. Okay. So again, thank you for inviting me. It's a real pleasure to be here participating with EarthMedic, Bajo, the university overseeing this, and the Caribbean Institute of Meteorology and Hydrology, and obviously Columbia University. Thank you for inviting me. I'm Pablo Mendez Lazaro. I'm from Puerto Rico. So I don't know if I need to speak Spanish or English in this case, but I heard that there are some interpreter. So I'm seeing people that are from even Peru, Brazil. So I think that we have multiple languages here. So I will try to do my best to keep it in English, just for the benefit of the interpreters. I'm going to be talking a little bit about temperature-related illness and mortality, but beyond just going into the numbers and how heat effects or heat is impacting excess mortality in the Caribbean region. Bring an example for Puerto Rico. I will talk about also some other interactions, right? So I know that this is not a climate change 101, global warming course or a presentation, but obviously it's always important to set the context on where we are, right? Because it's a unique scenario, the one that we're living now, not only for the Caribbean region, but for the whole planet, right? So heat, and then how heat is interacting with multiple other factors, right? This is not like a bullet, that there is an extreme heat episode and all of a sudden people are dying, like flies, right, or mosquitoes. So in this case, there is a process and an interaction with some social determinants of health that I will be explaining a little bit, and I'm sure that most of you are aware of what those are. Exposome, the level of exposure that each of us as individuals are experiencing. Landscape also, so different kind of designs. When we're talking about landscape, it can be from high density urban areas to low density urban areas to industrial, park, commercial, to natural reserves, forest, and green infrastructure. And then we can go to heat and mortality. Some kind of analysis, results, what we're seeing for the Caribbean region as a proxy for other places in the world. And also the compound effects. So how, in the case of the Caribbean, heat can be also as a process that is interacting with previous extreme weathers, such as powerful hurricanes, tropical storms, that are impacting all of the society, all of the infrastructure, all of the different essential services, and all of a sudden, you're also experiencing extreme heat episode in the aftermath of some powerful hurricanes. So it is the scenario is getting weird for the Caribbean region. So first of all, starting on where we are. So there is no doubt that we are experiencing one of the hottest era in the record in planet Earth, at least since the experience of humankind. Right, I'm not talking about millions of years, but at least since we are living in this planet. So global temperature has been increasing, and in the last 50 years, they have been increasing faster, which is crazy, right? It's insane, than in the last 2,000 years. So just to be clear on where we are on uncharted waters and uncharted territories in terms of climate change, and that means a lot of uncertainty not only for modelers in terms of projecting where we are going in the next couple of years with climate, but also what that means for a socio-ecological system in terms of adaptation, right? Uncertainty is always a difficulty to be better prepared and for adaptation. But just to be clear, 2023 was officially declared one of the hottest year on record by the European Union, by NASA, NOAA, and multiple other international agencies, official international agencies, right? So it's done. They're saying this is the hottest year on record that we ever experienced, not only in one region of the world, but worldwide. And what is even worse, what we're seeing here in this graphic is that the yellow line that we're seeing here in the left side is 2024. And we are already on the 10th consecutive month with the highest temperature on record worldwide. And as we can see here, 2024, temperatures are even higher than 2023. So what we're experiencing now is even worse than what we experienced in 2023, right? And we're not even yet in the, at least in the Northern Hemisphere, in none of the hemisphere, right? Because we're in spring in the Northern Hemisphere, so we are in the transition from one hottest season to the coolest season. But in the case of the Northern Hemisphere, we're still in spring, right? We're entering the spring season, and meaning that we can expect some prolonged and intense heat episodes during the summer and even the fall, right? This is also happening with air surface temperatures, and in the case of the Caribbean with sea surface temperature, right? Which is even worse, because in our case, for islands, as in many other coastal cities or coastal population, we are influenced on what is also happening with the ocean. So this heat episode, this warming is not only occurring with Earth surface temperature, but it also, which is worse, is occurring in the ocean. So the ocean is accumulating this amount of energy and is influencing our environment in the case of Puerto Rico, right? So that is increasing the amount of not only elevated temperatures, but also humidity. And the combination of both is what is getting the scenarios even worse for the Caribbean region, right? So when we're talking about, given that context, I would like to say then that, again, heat is not like it's not a bullet that is all of a sudden killing people, but it's interacting with multiple other aspects. And one of them is interacting with the landscape. And when we're saying landscape, we're transforming the landscape, we're developing cities, even bigger cities, and with development, we are creating urban climates. And these urban climates are promoting urban heat islands, which are places that with the materials that we're using for building, for constructions, and the colors, and the deforestation, we are increasing the amount of energy that we're retaining in the environment and increasing the temperatures in the surrounding areas. Green infrastructure, so ecosystems provide essential services, and they're valuable essential services. And one of them that green infrastructure can provide is regulating temperatures, right? So if we are modifying the landscape and we're promoting more urban areas, and we're not including into those urban areas the combination of green infrastructure with gray infrastructure, then we are increasing the amount of energy that we're retaining. So this is one of the interactions that we're seeing. And 70% of the people worldwide are living in urban areas, right? So this is very important. The reason why when we're talking about modifying the landscape in these interactions is because most of the people live, it doesn't matter where, but 70% of the population worldwide live in cities, right? Even though that in rural areas are being exposed as well and they're being impacted by heat. I'm not saying the opposite, but if we address these issues in urban side, we are, at least we're looking to work with 70% of the populations in most of the places. That's one of them, right? This is a graphic that it was done for the National Climate Assessment. The National Climate Assessment is the most important report in climate change in the United States. And what we're seeing here is the combination of how also extreme heat in urban areas is associated with some social determinants of health. So the social determinants of health are the conditions on how the people are born, they live, they work, and they die, right? And it's including different variables if we go there. So people living below poverty level, people with pre-existing health conditions, people that they don't have any kind of planning, health insurance, people with disabilities, and there's a list of 21, 26 different kind of variables on how to describe the profile of vulnerable population in urban areas, right? That are tied to social determinants of health. So what we're seeing here is how the people that are living not only below the poverty level, but with the lowest income in each of these cities that you're seeing here, Atlanta, Houston, and Minneapolis, all of the people that are living below poverty level or the lowest income, they are living in the hottest places as well in the cities, which it means that if for any reason your city is experiencing a heat wave, but obviously you don't have the resources to not only to buy an air conditioning or whatever kind of ventilation that you might be able to buy, but that doesn't mean that you have the capacity or the resources to pay for the electricity bill to keep it on for the long run, right? Because when we're talking about extreme heat, we're not only talking about intensity, but we're also talking about duration and frequency, which it means that it can last not only 3 days, but it can last for 1 week or 2 weeks. So with the people that are living below poverty level or the people that have the lowest income, it's more difficult to them to be prepared or to be better adapt to these kind of situations. And I'm not saying that the air conditioning or ventilation are the unique way on how we can manage extreme heat in urban areas. There are multiple other techniques and strategies that can be done. For example, reforestation, including green parks, including green infrastructure, managing the vegetation inside of the cities, using other colors, using different materials, right? But again, this is some kind of relationship that exists that is making it more difficult and unfair for those communities that are underserved and disadvantaged. As I mentioned, so some of the interactions that I already mentioned, some of them are the social determinants of health. Landscape is important. Urban islands, transforming the landscape, deforesting and increasing or promoting urbanization, but also the interaction with the characteristic of the community, right? It's not the same thing that you're facing an extreme heat episode, but you're living in a high income community and you have the budget to afford the electricity bill for 1 month using your central AC, right? So it means that you're probably are not going to be affected by the heat episode. But again, if you're living, if you have disability, if you have pre-existing health conditions, if you have diabetes, if you have some other cardiovascular diseases, they're more likely to suffer from these hazards. So in this case, climate change, what it's doing is also exacerbating the pre-existing conditions that we have in our society. It's not that climate change is creating all of the issues and problems that we have. It's that climate change is exacerbating the inequalities, the differences, the injustice, and the profile of this population. In the last NCA 5 also, so there is heat and equity understanding, right? And there is 4 main domains. So obviously the social and racial factors. In the case of the United States, it's pretty obvious as well that African Americans suffer more heat-related illness and are more exposed to extreme heat in urban areas than white people. So there is a racial factor as well associated with extreme heat in the United States. I'm not saying that this is happening in all of the places. With economic impact, you can see in the picture, there are some air conditioning hanging in their windows, right? I already explained a little bit about it. And also the location, obviously, I already mentioned it as well. So landscape is very important when we're facing or suffering an extreme heat episode. It's not the same thing that I'm living near a park, the Central Park or something green with lagoons, water that have the capacity to regulate the energy that we're receiving, that if we're living in high density urban areas without any kind of green infrastructure. So we're going to be more likely to suffer from extreme heat in those areas than if we're in other areas with green infrastructure. And the compound risk, obviously, is also that extreme heat and this kind of episode associated with climate change are not occurring alone in the space, right? They're also interacting with some other kind of risk and impact. For instance, in the case of Puerto Rico, when we are experiencing extreme heat episodes, the electric grid is so fragile and dire after the hurricane season of 2017 that when we suffered the Hurricane Maria and Irma, it got almost destroyed. And I'm sure that many other islands in the Caribbean are facing similar issues that we are here in Puerto Rico. So what happened is that when we're facing these extreme episodes, the energy demand increases so much that the system collapses because it doesn't have the capacity to satisfy the amount of energy that the population is needing to regulate or to mitigate the extreme heat episodes, right? So how do you do it? How do you deal with those kind of issues when you have a dire electric system and all of a sudden when there is an extreme heat episode, unfortunately, what you are requiring more is energy in most of the cases to mitigate, right, this heat episodes. It's not the only way. Again, I'm not saying that the air conditioning is a magic stick to solve all of the issues associated with heat, but it's a proxy. It can help to mitigate and to avoid mortality. Then we continue doing the downscaling. So we started by the community, regional areas, urban sites, and then we go into the individual level, right? And each of us has a very different thermal comfort, meaning that the thermal comfort is not only looking at temperatures and reading at or characterizing the weather, how the weather is out there or indoors. It's not only looking at how the mercury is increasing or decreasing inside of the thermometer. It's beyond that, right? The thermal comfort is something that is defined for each of us. And it's a combination between air temperature, radiant temperature, wind speed, relative humidity. The combination between relative humidity, water vapor, and temperature is the perfect combination for to increase mortality as well. One of them, right? Also, your characteristic is not the same thing if you're part of what we call vulnerable groups, elderly, children, people that have 85, 75 years old that are living alone below the poverty level. So age is important as well. If you're a woman and you're pregnant, if you're receiving some kind of treatment, for example, right? We're talking about metabolic rate. We're talking about clothing, the kind of clothes that we're using, the materials that we're using as well. If you're receiving treatment, for example, cancer patients that are going into chemotherapy, there are some side effects, and one of them are hot flashes. These people are more likely to suffer nausea, dehydration. They don't have appetite. They don't want to eat. They're also suffering from vomiting and diarrhea when they're doing this kind of treatment. So they are already experiencing some kind of side effects that in normal condition without extreme heat, you are more likely to get dehydrated than someone else, right? On top of that, if you need to feel and to experience an extreme heat episode, it's going to be even worse for you that are receiving chemotherapy than for others that are young, healthy, 25 to 30 years old, athletes with good nutrition and all of that, right? So those are the kind of things that we need to consider when we're talking about heat. And obviously, then if we have a pretty good idea of the profile of the people that are getting impacted, all of the adaptation strategies and protocol and mitigation actions can address very specific population by identifying who are literally the most vulnerable to heat in different areas. So beside the thermal comfort, there is also the exposome. And the exposome, I'm sorry that I used the word in Spanish and I didn't notice. Sorry about that. It means the 3 different domains on how we are getting exposed to different kind of environments. right? The exoenvironments, meaning that we we get exposed in our labor areas, in our occupation, we're getting exposed to temperatures, or also some air contaminants indoors environments and in outdoors environments where we work, where we live. We are getting exposed to climate, to ecosystem, allergens, for example, air pollution, and those kind of things. That's the exogen, right? Then we have also some kind of behaviorals and risk factors. If we smoke, if we drink alcohol, if we use drugs, the kind of lifestyle, if we do a sport, if we don't do sport, if we sleep, if we have stress, mental health, if we, whatever kind of other behavioral aspect that we're doing is also interacting with this exogenous factor that is exacerbating our conditions. And then the endogenous factors, our genetics, pre-existing health conditions. If we have diabetes, if we have cardiovascular diseases, if we have kidney disease, hypertension, obesity, cholesterol, cancer, whatever kind of other kind of conditions that are part of our body that can exacerbate the way on how we interact with heat, right? So, and again, I mentioned it, and I would like to highlight this. It's not only temperature, it's not only heat, it's the combination of heat with humidity, right? The one that are getting too severe for human tolerance. And this is a research manuscript that I read a couple of years ago. It came out in 2020, so it's already 4 years ago in Science, one of the best journals of science available. So again, it's heat and humidity. So this is even worse for those tropical areas, right? Because in tropical areas, it's not only the elevated temperatures, but also in the case of Puerto Rico, that we are influenced by the ocean, as I mentioned at the beginning. It means that if the ocean is experiencing heat waves, the ocean heat waves, right? It means that the water temperature is so elevated that it's most susceptible also to be evaporated. So it's transferring water vapor to the atmosphere, and that combination is making it worse, the sensation, right? So by sweating is the first phase, that is the first step that our body starts to regulate the temperature, right? But it's by the evaporation of that sweat from your skin that your body actually starts to reduce temperature. But if there is a large amount of water vapor in the atmosphere, it's very difficult to that sweat to get evaporated from the skin, which means that will increase your body temperature, and it's going to make it more difficult for your body to mitigate or to regulate your temperatures, right? And this is what is happening, right? And we're experiencing that. But it's even more interesting is that, again, another international agency, well, in the United States, but we know that it's a very famous agency in terms of science, right? It's a leading agency worldwide with science. They make this announcement in 2018, even before this research came out in Science. And again, I'm using this example because I consider that Science is one of the best journals for scientists. But then all of a sudden, back in 2018, NASA was saying that, hey, guys, there is a potential super greenhouse effect in Earth's tropic, right? So the Northern Hemisphere is getting warmer than any other places in the world. And the other places that are getting warmer very fast are the tropical regions. And why? Because there is a lot of, again, a lot of water available in the ocean, warm water that is able to evaporate to the atmosphere, but also because of the tropical forests. So these tropical forests have the capacity to evapotranspirate the water that is being stored in the soil, right? So they're transferring also this amount of water. And as much as the temperature is continue to increase, more water they're going to be transferring to the atmosphere. And water vapor is 80% of the greenhouse gases in the atmosphere as well. So it means that we continue to have a little bit of more water vapor in the atmosphere, and most likely increasing the greenhouse effect for the tropical regions as well, right? And now I'm going to be giving a a couple of examples about Puerto Rico, and then I'm going to be jumping into the mortalities analysis. But again, I wanted to explain first that, again, this is not something that, this is not an earthquake, that the building is collapsing and people are dying, unfortunately, underneath the material construction. In this case, it's more complicated, right? So that's the reason why I'm investing so much time in these interactions instead of just bringing results and numbers on how heat is increasing mortality. So these are thermal images infrared sensors that we're working with the University of South Florida and together with us with the Medical Science Campus in Puerto Rico. These are from Landsat, and this is a climatology. What we're seeing here is in red are the high-density urban areas in the case of Puerto Rico. This is our island. And what we're seeing in green are forest, green infrastructure, vegetated landscapes, and urban water bodies. We can see, and these are land surface temperature, meaning that this is not Earth surface temperature. Earth surface temperatures, in most of the cases, and I will say that always, is the temperatures that we're feeling in the air column 2 meters above the ground. Okay, that's the mass of air on what a normal human body can interact with the atmosphere, right? When you have your feet on the ground, unless that you measure more than 2 meters. So, but for most of the people, we are walking and getting exposure with the atmosphere below the 2 meters 2 meters above the ground, and that's it. In this case, this is land surface temperature. What we're seeing here is the amount of energy that the surface is emitting back to the atmosphere, right? And we're seeing that it can go up to 64 degrees Celsius in some places. I'm talking about roads, roofs, industrial parkings, commercials, shopping centers, residential areas, airports, those kind of things, okay? And what we're doing here is that we're also understanding, so, okay, we now have a downscaling to the San Juan metropolitan area. San Juan metropolitan area is the capital city of Puerto Rico, and it has almost 500,000 people living in it. So what we're seeing here is that the blue dots are what we call the social vulnerability index, that is showing the household characteristics. So it means that these people that are living below the poverty level, that there are community disadvantaged communities, underserved communities, and there are low-income communities. And what we're seeing here by identifying where are those hottest places, the warmest places in the cities, but also identifying the profile of the communities that are exposed to these urban heat islands. So if we need to address some kind of strategies, we know on where to address these issues with the communities here. We're seeing, obviously, this is the low vulnerability area, is high income communities. We can see high vulnerability areas are low income communities, and then medium vulnerability areas are those with, obviously, medium incomes and families, right? When we're talking about vulnerable population, we're seeing, in some cases, most of the cases, these kind of messages, right? We're talking about pregnant women, we're talking about newborn children below 5 years old or something like that, elderly, and people with chronic disease. But it's even beyond these characteristics, right? These are very big groups, because if you're elderly, and if you have chronic diseases, so you have a combination of both, right? So age is one factor, and the other one is chronic diseases. So it can be a combination of all of this, right? So it's more complicated. But also, if you add, to this description of vulnerable population, that I agree with it, right? I'm not criticizing. I agree with this description. But we need to consider if you're elderly, if you have chronic diseases, if you have cardiovascular diseases, diabetes, or cancer, and you're living below the poverty level and you don't have any kind of insurance, to health insurance in the case of the United States and Puerto Rico. So it means that you are very, 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 very high vulnerable to heat episodes, right? Because you're elderly, you have a pre-existing condition, and you don't have the budget or the resources also to pay for electricity bill, or even to get to healthcare services because you don't have a health insurance. So it's even worse, right? It's the combination of multiple factors that is making you more vulnerable. Sorry. So the typical heat-related illness and deaths are heat stroke, heat-related conditions, cardiovascular disease, respiratory and cardiovascular, and cerebrovascular diseases. But there are multiple other factors that are contributing to heat. Living alone, people living below poverty level, working in confined spaces, working outdoors, living with disability, with chronic health diseases, or without health insurance coverage, as I mentioned before. There is no specific threshold neither to consider, as you can see here. For example, hospitalizations in the northwestern part of the United States, they start to increase their peak above 81 degrees Fahrenheit. But if you go to Texas, people have more adaptation capacity probably, or they have more thermal adaptation, I will say. So hospitalization only increase when the temperatures are above 105 degrees Fahrenheit. So it's a different almost of 20 different degrees Fahrenheit between one place and another. So the thresholds are not the same, meaning that, as I mentioned before, the thermal comfort is very different for all of us, right? So we can see here the southwest of the United States is less sensitive, but then we can see that the northwest is more sensitive, because we're saying that even with 81 degrees Fahrenheit, they're already going to the hospital. They're being affected. And we're not the one to say if they're feeling hot or not, right? Because this is something that they can perceive, and this is something that is affecting them alone. In the case of Puerto Rico, we're experiencing also high temperature. We're breaking records very recently, with temperatures increasing 95 degrees, 96 degrees. But if we're seeing this in terms of heat index, we're above 113, 125 degrees Fahrenheit, which is almost rising 35 to 38 degrees Celsius, right? Which are getting to heat stress, reflecting heat stress in multiple areas of Puerto Rico. And what is expected is that obviously is also associated with excess mortality in multiple places of Puerto Rico. Heat is very well known as a silent killer in multiple places worldwide, and also in the United States, and in the case of Puerto Rico as well. So if we're seeing all of the different ways on how to treat it, heat is the #1 hazard when we're talking about hospitalization, emergency room visits, and mortality. And in the case of Puerto Rico, it's happening as well. So this is one of the facts from the CDC, where we're seeing, okay, so we have this previous graphic that is showing that actually heat is the #1 hazard in terms of fatalities and death. And we can see the group distribution, age distribution here on the people that are most affected by these kind of hazards. We're not talking about young people. We're not talking about high-income communities. Again, these are exactly the same disadvantages and underserved age groups. In the case of Puerto Rico, we are doing some analysis, and we found back in 2016 and 2017 that actually we don't have superpowers, and actually the people are dying in Puerto Rico as it's happening in many other places. So we don't need to wait for a heat episode with, as I showed before, with up to 113 or 100 degrees Fahrenheit in the case of Puerto Rico. So there is an increasing trend with temperature associated with temperature in Puerto Rico, even with temperatures as low as 89 degrees Fahrenheit, right? Obviously, unfortunately, the people that were more likely to die were people with diabetes, cardiovascular diseases, obesity, elderly, yeah, and that's it. So yeah, unfortunately. We also did an analysis for hospital admissions. And what we're seeing is that hospital admissions in the case of Puerto Rico, we're talking about a tropical warm environment that people will say, but you should be adapted to heat. But we're not. Actually, we're not, right? Again, we don't have superpowers. We're not superhumans. So we are dying as many other people as well, or we are at least requesting emergency or health services when temperatures are elevated. So in the case of hospitalization, at least there is a 6% increase for hospital admission in the case of cardiovascular diseases. So when we're talking about per year, so when we're talking about hundreds, thousands of people that are visiting the hospitals, given cardiovascular issues, if you're talking about 6% increase during heat episodes, that's huge, right? That's huge. We're talking about hundreds and hundreds of people that are being impacted. And as we're seeing in the epidemiological parameters, right? If we are able to characterize and to identify that there is actually an excess mortality in the people, that means that below that iceberg, there is a lot of other people that are being affected by this hazard. But for whatever reason, they are not being recorded because they're not requesting health services or they're not dying, right? So below that pyramid, we have excess mortality. Then we have people that are visiting emergency room visit and hospitalizations. Probably we might see also an increase in medical doctor visits. But then there's so many other people that are being affected, but for whatever reason, they're not looking for health services, right? So we're not capturing the full information or the full impacts of heat in this population. There's some other parameters. As I mentioned before, temperatures is not a very well predictor for mortality and impacts on public health. So we're using combination of different indices. So there is a universal thermal climate index, and that is the wet bulb globe temperatures. Both of them are very similar. One is mainly used in the European Union, and the other one is more being developed in the United States. But the intention is that, okay, so analyzing and looking at temperature is not enough. It's not enough to say that there is going to be an impact on public health. We need to consider multiple other factors and create this kind of index that is considering wind direction, wind speed, air radiation, clothing, humidity, and multiple other variables to actually say if this heat can be creating heat stress in the population, right? So we did an analysis and we evaluate and analyze how the Universal Thermal Climate Index for the Caribbean region has been changing in the last couple of years, in the last 30 years or so. And unfortunately, we're seeing that the Universal Thermal Climate Index, which is an indicator for heat stress, is increasing in the Caribbean region, unfortunately. And when we analyze that with mortality, for daily mortality island-wide in Puerto Rico for 5 years period, non-accidental mortality, what we found is very sad, right? We're seeing that myocardial infarction is increasing by 60% in the with UTCI when there is above 33.9 degrees Celsius. And as you can see, heart failure, cerebrovascular diseases, and cardiovascular disease. So there is a lot of evidence that unfortunately all these heat episodes are affecting public health in Puerto Rico, but are also creating mortality. So it's something that we need to deal with. We live, as I mentioned, as many of you, because I saw multiple regions and countries in the chat. So we're living in a warm, tropic, humid environment. But again, I will say it again, we don't have superpowers, and unfortunately, we are not being prepared for this kind of extreme heat episodes. These are the graphics that are showing also how this mortality is increasing in different areas, unfortunately. And just to finish, on understanding heat beyond mortality. So right after Hurricane Maria, we did an analysis. We obviously, as many people in Puerto Rico, we started doing public health brigades, helping the disadvantaged communities and providing essential services, supplies, and whatever we can do to avoid mortality. Unfortunately, there was an excess mortality as ever recorded in Puerto Rico. So it was the deadliest hurricane season in 2017. Beyond that, I put my hat of scientist after working with some communities, and we noticed that women's were most affected than men's in Puerto Rico with the hurricane. So it has a gender issue. And on top of that, we noticed also that people, obviously, that as it was affected with pre-existing health conditions. So we started working with women's in Puerto Rico and Virgin Islands with gynecological cancer, that their treatment, that they were under treatment, or that they were expecting to start treatment for cancer during that season in 2017, right? So we wanted to understand also the barriers, obstacles, vulnerabilities that they suffer in the aftermath of Hurricane Maria. And we start to identify the different kind of things in terms of stressors, additional stressors that they face in the aftermath. And we're going to see here, so this is a word cloud. So this is incorporating some statistical analysis inside of it. And the biggest that the word is the most important for the women with gynecological cancer in Puerto Rico and Virgin Islands. So the house is the sanctuary, right? That's your home. That's everything for you. That's the most important thing. Water for life. Obviously, it's important for everything as well. Water is essential. But what we were very amazed to see is that all of them that were also telling heat, right? So they were telling you heat is crazy, it's insane, it's affecting us. As I mentioned before, cancer patients already, they suffer for hot flashes. So we start analyzing then the information as well with the data, ground-based stations, satellites, and we were wondering ourselves, so heat is fuel for hurricanes. Heat, warm waters is fuel for the development of powerful tropical storms in the tropical waters. But what we were not aware is that heat is also part of the aftermath of this powerful storm. So we were able to identify that in most of the islands, we analyzed I don't know, 205 different storms that passed through the Caribbean region, and we were able to found that actually all these tropical storms passing nearby, in the aftermath, there is an increasing temperature, there is a heat episode that occurred in the aftermath. But what we're talking about, this is a compound effect, because the powerful hurricane is destroying all of the green infrastructure, destroying all of the ecosystem services that are able to reduce the amount of energy. So regulating temperature, all of the forest was destroyed, defoliated, and there was a lot of water because of the floods and the inundation. There was a lack of energy because the electricity system collapsed, right? So without energy, without green infrastructure, and treatment with chemotherapy, it's normal that these people were suffering from heat after Hurricane Maria, right? And we were confirming that actually this is what is happening. This is being normal. We were amazed. We say, okay, wow. So that means that we need to be prepared that after a hurricane, we need to pay attention also to a heat episode that it will come in the aftermath of the hurricane. And I will not go into the details of the climatological aspect of why this is happening because I don't have time. But again, it happened with Hurricane Fiona. So almost 5 years after Hurricane Fiona, a very small hurricane, but obviously energy system collapsed in Puerto Rico. What we're seeing here in these tachometers are the clients that have the electric system. And what we're seeing is that below, right when the hurricane Irma, no, right now, 4 days after landfall of Hurricane Fiona, that landfall was in the September 18, 27% of the clients were without energy. No, sorry. Only 27% they have energy, meaning that 80% of the population were without energy. And we are seeing here that the National Weather Service was issuing an excessive heat risk for most of the coastal areas of Puerto Rico. 5 days later, we still have only 37% of the population with energy, 37% with energy, and still some areas facing extreme heat episodes in the aftermath of the hurricanes. So with that, I just finished my presentation. I just wanted to give you an overview and a really big picture of heat and how it can be unfortunately increasing mortality. Thank you so much, Paula, and thank you.
Thank you so much, Dr. Lazaro, for presenting that very instructive presentation, telling us a lot, a world presentation. And it's scary because, you know, you're telling us that 2023 was the hottest year on record, and yet you're telling us that 2024 would even be hotter than 2023. And when we look at the stats, when we look at the mortality figures, the increased hospitalizations, it is not a very promising prospect at all. But the good news is that teams like yours, we are working together to try to find solutions and to find strategies to deal with this climate crisis and this increased heat that we are seeing. Yes, this is indeed a very complex scenario, and things are getting worse when you think of all the excess mortality that we are seeing, and we are only seeing the tip of the iceberg. this concerns me and it concerns all of us as scientists in this dilemma. However, I wouldn't want to spend too much time because we know we have a lot of questions for you, Doc, and we want to have our next presenter coming on, Shanice. Thanks for, okay, so you're on. You can share screen now and take it away. We would be waiting to hear your presentation. Thank you, Shanice.
Okay, so good evening. It's evening for me, so good evening. Are you hearing me?
Yes,
Are you
here.
hearing?
Yes,
Okay,
we can
great.
hear you clearly. Yeah.
Okay, great. So thanks for having me. Dr. Pablo's presentation was a great baseline for what I'm about to talk about. So I am the former national coordinator for the short name City Adapt project in Jamaica. Right. The City Adapt project and the long name, Building Climate Resilience of Urban Systems through Ecosystems-Based Adaptation in Latin America and the Caribbean. And the presentation before would have detailed many of the challenges that we have and that we're experiencing in the Caribbean and that we anticipate that we will also be experiencing because of climate change. And being a small island state, and for the region, we really need to learn to adapt to the effects of climate change, one of which is the heating that we're facing now. So it's a regional project, the City Adapt project, and it was implemented in Jamaica, Mexico, and El Salvador through funding from the Global Environment Facility Special Climate Change Fund. The project was implemented through the United Nations Environment Program, and in Jamaica, it was done through the Climate Change Division. The major objective of the project was to increase the capacity of government and locals in cities of the Latin America and the Caribbean region to adapt to the effects of climate change through the integration of ecosystems-based adaptation, or we say nature-based solutions. And we want to get that implemented into medium to long-term planning. So nature-based solutions really speaks to using nature to adapt. Like, how can we use what is available to us in nature to adapt to some of these impacts that we're facing? And so the project was implemented under three main components. And component one looks at how do we enable, how do we create an environment that enables the mainstreaming of EBA into medium and long-term urban development planning. So the project targeted planning entities such as the municipal corporations and environmental entities. And component two looks at demonstrating some of these activities. So we go into communities within urban spaces and implement some activities to demonstrate the benefits of them to the persons around. And so these can be later upscaled to larger areas. And component three, very importantly, we wanted to document what we did. We wanted to ensure that we were able to share widely the findings from this project. Let me know that it was a pilot project, so it was small scale, just within Kingston. And so we wanted to ensure that we had all the information, well, as much as we could, to promote larger scale nature-based solutions within cities. So to get this project done, we went through local partners, the Nature Conservancy, the Forestry Department, and the Jamaica Forage Clubs. And these partners were selected because of their own mandates and their expertise. So the Nature Conservancy had experiences in similar projects, and they dealt with policy and the policies surrounding nature-based solutions and environmental management before. The Forestry Department, they they have the mandate on all things trees in Jamaica, and the Jamaica Forage Clubs are intimately involved with the youth in the country. And we wanted to take this project to the youth. We wanted to plant that seed so that they can promote nature-based solutions and they can buy into the idea and take it along with them as they grow. Now, through the Nature Conservancy, we created 2 policy briefs, and these focused largely on looking at environmental policies, planning legislation, and identifying gaps within them. And what we found is that not many speak directly to nature-based solutions. Even if it is mentioned, it is not really of priority. And so recommendations were made to the ministry on the specific policies that could be adjusted, and even the ones that are coming up for review, and how these could be, the wording that could be used, and how these could be adjusted to include nature-based solutions. A vulnerability assessment was completed for the Hope watershed, where the project site sits, and this highlighted to us that there were many challenges. They were anticipating increased heat, we're anticipating reduced rainfall, increased sea level rise, and all of these things will be impacting the urban space. And so what are the recommendations for nature-based solutions that could be used to combat some of these challenges? We also developed a training course on nature-based solutions in urban spaces, and this was delivered to over 100 persons, 85 of which were a part of the government and a part of the planning entities. And so this course, now we're trying to get this course integrated into the universities to have some sort of sustainability of what we're trying to promote. So the course outlines the challenges faced by urban spaces and how these can be addressed using nature-based solutions. We also created a strategy on how we can take these nature-based solutions from these pilot activities and increase them to larger spaces. So we promoted tree planting in urban spaces. We know that we tend to remove trees from urban spaces. So we are encouraging tree planting in urban spaces. And what this does, this assists with reduction of heat, improves mental health, increases biodiversity. And if we planted 6,100 trees within urban schools and communities. We planted 2,200 mixed seedlings also within schools. So that is, so the 6,100 was in the upper watershed area, and the 2,200 mixed seedlings were within specific sites. So within the project site, we planted over 5,000 seedlings in the urban space and 6,100 in the upper watershed. And the idea is that we will start to reintroduce the trees, and Kingston is mainly concrete. There's not much nature. And so we're trying to bring nature back into the city to assist with problems such as heat. We also rehabilitated some wetland spaces. Over 2,000 mangrove seedlings were replanted in the space as well. The Jamaica Forage Clubs, as I said before, they are integrally involved with the youth of the country. And so we worked through them to engage schools. Within schools, we introduced urban gardens, greenhouses, hydroponics, container gardens. And a lot of these city schools, they don't have much space, and they suffer from the heat problem as well as reduced rainfall. So there's not much water, and some don't have consistent water flow. And so the project installed 6 rainwater harvesting systems within schools and community spaces. One school was the Abilities Foundation, which is a school for special needs. And so the rainwater harvesting was established there. as well as a farm area where the water was used to supply that area as well. So we also promoted alternative livelihoods. 50 persons in urban space were trained in urban beekeeping, and over 250 colonies were distributed. So with the bees, we're trying to get the biodiversity within the cities back up, and that should increase vegetation and increase the use of the spaces in terms of a nature-based solution kind of way. So we also supported 3 students to complete their research, and these were looking at ecosystems-based adaptations within cities, and using sargassum as a way to treat the trees, the mangroves that are planted within the space. We have developed guidelines, that's extensive documents on how to conduct activities such as urban forestry. So these guidelines speak to the species that you use, it speaks to the purpose of it speaks to the benefits, and it gives step-by-step breakdowns of how these activities can be done. So all in all, the project aimed to target urban spaces and to reintroduce nature into urban spaces in an effort to combat some of the challenges that we will face with climate change, including increased heat, and reduced rainfall and increased flooding as well. Thank you. That's it from me.
Thank you. Thank you so much, Shanice, for that very informative presentation and for giving us hope. Because after all, that's what we need. We need nature-based solutions, right? And oops, okay, I don't think you all can see me, but I think, oops. I'm having a little distress. I can't seem to get my video started. But you can hear me? Yes. Oh, okay, Shanice, I don't know why I can't get my video started. Can you put me on video? So yes, Shanice, thanks for that very informative presentation. Indeed, nature-based solutions, that is the solution, especially when you, okay. Thank you. Especially when we found out from Dr. Pablo Mendez that we had a problem with urbanization. 70% of the people living in cities. We definitely need to have some kind of greenery, some kind of plant-based urbanize on this problem with urbanization. So thank you for that. Thank you for telling us solutions on how to make this possible. We look forward to hearing a lot more about your project in the future. I'm sure this is not just the end. This is just the beginning of things to come. Thanks for sharing. And our next presenter would be Lindonne, and she would be telling us, incorporating into her session, a little bit about what Dr. Winchester would have been presenting. But so she is going to tell us a little bit about that, and Dr. Winchester will be presenting at a later date after she has completed a lot more of her research. So we look forward to hearing a lot of your presentation, Lindonne. So take it away. Thank you very much.
Okay, thank you very much, Dr. Henry, and greetings to everyone. I recognize that we have people from the different time zones. So I'm going to share my screen. Okay, so just can you confirm, Dr. Henry, that you can see my screen and hear me?
Yes, I can hear you clearly. We can see your screen is in full mode presentation. So
Okay.
you can go ahead. We can hear you clearly.
Thank you very much. So I am presenting today on a project that was sponsored by the Pan American Health Organization to establish impact-based heat threshold in or for Grenada. And I want to begin by acknowledging the persons who contributed or participated in this study as the steering committee. As you recognize here, several organizations, regional and international organizations, were contributed to the development and oversight of this study. So first, I want to speak a little bit about the rationale for impact-based heat studies in the Caribbean. And the first speaker already spoke about what has been done in Puerto Rico and studies in other places. And I want to highlight in particular that we are lacking as a region in studies that investigate or analyze the correlation between extreme heat and morbidity and mortality. So we saw from previous presentations that some work has been done in the larger Caribbean islands and so, but from the perspective of small island states like Grenada and the other Windward Islands, we still do not fully understand the true burden of heat impact on our populations. There are a few studies done already on heat and food producing livestock, such as poultry, pigs. We even saw studies related to ocean warming or heated temperatures and fishes and so. The WHO has produced a list, a chart that indicates the direct and indirect effects from exposure to extreme heat. Now, the CIMH is also and continues to advocate for improved heat wave forecasting in the region. In other words, it is important for us not just to announce that a heat wave is now ongoing, but also for the Caribbean to build its capacity to forecast so that our population can be warned ahead of those kind of events and can be better prepared. So we need to still build evidence of the impact. We need to manage the knowledge, ensure that small island states can benefit from the research done in other countries as well, and disseminate information across the region. Many of you might be familiar with the document produced by Pan American Health Organization to guide our health practitioners and our medical personnel on climate-sensitive diseases and some of the clinical management protocols that can be applied in such settings. So all of this tells us that heat impacts is significant in the region, and it is one of concern that we need to be mindful of. So this is the chart from the World Health Organization. And I just want to point out here that all of this will influence emergency room visits, hospital admission, and of course, mortality. And overall, this again will have impact for the functioning, the financial allocations, capacities, and so, and the whole response mechanism of the health sector. So we have to look at those things very closely, how heat is impacting emergency room visit, hospital admission, mortality, etc. So this was a study here that was done by Pan American Health Organization. I was the consultant for this project, and the intention really was to develop a methodology for establishing heat threshold in Caribbean countries. So Grenada was just a pilot country for this study or this work. And we were looking towards developing or creating heat health action plan, which of course will incorporate early warning system and eventually reduce mortality and morbidity in Caribbean populations. I just want to point out here two things that were unique about the approach that we use. So when we looked at work done in other studies, there were several methodologies used across the world, but we focused on a methodology that we thought was a bit unique and would have given us very detailed information with regard to the impact on health in the Caribbean. So we used, rather than one proxy, meaning either morbidity or mortality, we use what we call a dual proxy approach, where we looked at the impact on mortality, but also on morbidity. A second thing that we do not find common in the approaches used by several in several projects is that of including what we call lag and cumulative exposure days. So we used the distributed lag nonlinear model to do our study, the DLNM to do our study. And so we were able to get results for what we call forward interpretation. That is the probability of increased risk of the outcome after X days following the event. That's the forward interpretation. Going forward, what kind of risk or how much increase in risk will result from exposure to this condition after X amount of days, and also backward interpretation. But for this presentation, we are going to focus on forward interpretation. So quickly, measures of association, just to take you back to statistics and epidemiology class. So the model generated for us relative risk, which is the probability of an event. And in this case, we focused on emergency room visit, hospital admission, and mortality occurring when with an exposure versus the probability of the event occurring without the exposure. And because Grenada is a small island, just 133,000 square miles, we assumed that the entire population was exposed when the event occurred versus when the event did not occur, okay? And we use records from the General Hospital. So those were limitations in the study. We focused on one sentinel site, and we also made the assumption that everyone was exposed at the same time when temperature and so was at a certain value. So we sourced epidemiological data from the General Hospital and also mortality data from the Ministry of Health for the years here, 2016 to 2019 for emergency room visit, hospital admissions from 2014 to 2019, and then the mortality data 2014 to 2019. We got an extensive database from the Meteorological Office, which is located in the south of the island at the Maurice Bishop International Airport. So we had data from 2005 to 2020. So we incorporated data for respective years based on what we wanted to model, the period that we were including in the model. Notice here that we use temperature, relative humidity. We tested all of those to determine whether there were any impacts on the three health outcomes. Also heat index, which is a compound index. And as our first presenter indicated, this looks at temperature, or it considers temperature and humidity, relative humidity together. So this is the process that we use from the collection of the data to the analysis and interpretation. We had some data cleaning, etc., as is typical before you do an analysis. So the results, what did we find? And that's what I really want to share with you. So we found the highest probability of increased risk. We're talking about relative risk of morbidity and mortality in the population, that's in the Grenadian population, was associated with changes in temperature and heat index. Remember, I said heat index is a compound index or parameter. It looks at temperature and relative humidity together, and it's what we call the feel-like, right, temperature. So those two, temperature by itself, controlling for relative humidity, and when the two together were considered, they had the greatest impact on health outcomes in Grenada, which was quite interesting. Now, this chart here, I just wanted to show you what is happening in Grenada in terms of temperature values from the period 2005 to 2020. And you would see here, if you look closely, you would notice that if you place a ruler across this line, you would see that in the latter years from about this point here, you would see that the values have been rising. So there is indication that temperature has been increasing in Grenada. You would also notice here that there are less values below the line as we progress in time compared to 2005 and the earlier years. So the values, the dots below the line here, you would see much more and much lower. But as we progressed over time, less values are below the main line. So that indicates that temperature is really increasing in Grenada. We also found here that, and we looked at values that were equal or greater than the 90th percentile. And what we saw here, and I want to point out, at 33 degrees Celsius, we noticed that there was a 190% increase in risk of mortality in the immediate, within 1 or 2 days. And that's very significant. The other values were not as significant. The risk was a bit lower, but still notice that there was some increase in risk. Once the number is above 1, that represents some increase in risk. But we had the greatest increase when temperature was at 33 degrees Celsius. Then we saw a 190% increase in the risk of mortality and in the immediate period, and that's significant to note. We also see here for heat index that at 35, when heat index was at 35 degrees Celsius here, that there was a 120% increase. But look at what happened at the 90th percentile values and above. And these are conditions that we are experiencing in Grenada. We had 300% increase in the risk, but at 41, 400%, and it was not just the risk of mortality, but also the risk of hospital admissions. So it's likely that more people will be hospitalized, and that will be associated with an increase in the value of heat index. But for temperature, it would be mortality as well as heat index, significant increase in the risk there. Finally, from this finding, what are we recommending? What do we do? And this is what we are recommending for Grenada, that there be a 3-tier warning system. At 29 degrees Celsius, because of what we saw here, although the change was not significant, we are still encouraging caution. At 30 to 32, extreme caution, and 33 and above, danger, right? Because there has been significant change in terms of the increase in risk of death when temperature reaches 33 degrees Celsius. And for heat index, which we think is a more appropriate index for use in measuring the impacts, 35 to 38 caution, 39 to 40 extreme caution, and 41 to 45, when we reach to that point, danger. And I'm pretty sure you would recognize that from what we have been experiencing recently in the Caribbean, that we are indeed experiencing those kind of conditions, and there is the need for heat warning so that we can protect the health of the population. We need to consider adaptation measures so that we can indeed inform the population ahead of experiencing those kind of conditions. We did have some limitations in our studies, and we'd like to also share that with you. Most of our data is still paper-based. We are transitioning to electronic records, but at the time of the study, we had to do paper-based. Also, we focused on just one sentinel site, as I said, the General Hospital. And we did not use data for a very long period. And most studies, if other countries have data for an extended period, we encourage its use greater than 30 years. And that ends my presentation. Thank you very much.
Thank you very much, Dr. Telesford. That was indeed a very clear presentation, and it gave us guidelines for going forward. We know that there can be no policy change without evidence-based data. So thank you for that. I'm not too sure why they keep on knocking me out. I think probably because I don't have a very good looking face. We only have a few moments, a few minutes for questions. So could please, thanks Dr. Mendez, thanks Dr. Telesford. Shanice, can you put back on your mic? So we are going to have a few questions here. Probably just one question each for everyone because we're out of time, but I want to remind you, please join our WhatsApp group. It's posted in the chat. It's the best way to keep informed and to know where we are going. Another thing, please fill out our post survey by clicking on the link. And in that link, you will find where you'll be able to apply for CMEs. Okay, so please. And that link closes in 2 hours after the presentation finishes. Okay, now let me look at some of the questions. Okay, so I will ask the questions and then I will let you answer. So for Shanice, what is the biggest challenge of the City Adapt project? And for Dr. Pablo, what does extreme heat in the face of climate change mean for persons residing in the Caribbean going forward? Despite the greenery, we are hot all year round and most of the people do not have the resources to adjust and cope. What implementations would you suggest aside from government implementation? And to Dr. Telesford, it seems that the outcome was measured at the individual level or in a particular hospital. So how do you measure temperature and humidity to link it to the outcome? Who wants to start first?
I can start. My person was first. All right, so the biggest challenge that we faced was getting the government entities to take the project seriously and to be a part of the project. Initially, we wanted the project to go through the municipal corporation since they're responsible for all things planning and development at certain scales, but we didn't get the interest that we wanted to. And so the biggest challenge was just to get that interest from the person. So we had to improvise and use other local partners.
Well, that is important, to go where you're getting the help. That's a good rule of thumb. Thank you, Shanice. That is helpful. Okay, Dr. Mendez, you want to go next?
Yeah,
you remember
okay.
your
I
question?
don't want to, but I will.
But thank you very much. We appreciate that.
So you're asking what are the most
Yeah, we
important
ask,
issues?
yeah. Do you want me to repeat the question?
Yeah, please go ahead.
Okay, right. What does extreme heat mean in the face of climate change for person residing in the Caribbean going forward? Despite the greenery, we are hot all year round. So what implementations would you suggest aside from government interventions?
Perfect. Okay, thank you. So what does it mean for the Caribbean region? First of all, we need to deal with risk perception, right? We are islanders. We live in a tropical, warm, humid environment. And we think that these kind of hazards are not affecting our health, right? Are not affecting the socio-ecological systems surrounding areas where we live on. And actually they are. We're seeing evidence, robust evidence on different islands on how this is affecting. So we need to deal with that a misconception that because we live in the Caribbean, we're not being affected. Yeah, people in Texas are also used to heat and they're dying as well. People in Arizona are also exposed to heat and they're also dying. And if we go to the other side, Siberia, they're used to cold areas, but that doesn't mean also, right, that they can get cold stress as well. So we need to work with that misconception. So capacity buildings, communication. We need not to be alarmist. We don't not to create chaos, but we need to be consistent with our message in order to respond better. There are multiple other initiatives going on, not necessarily tied to the government. So lucky for us, we have multiple community-based organizations, not to say thousands, in Puerto Rico. Not all of them, but a lot of them are working on sustainability and climate adaptation as well. So communities are getting this into their own hands and starting to work toward sustainability, resilience, and adaptation, trying to cope. And extreme heat is one of the hazards that they're addressing as well.
Thank you. So we need to involve everyone, citizen science, not just government, all of us, health practitioners. We need to wake up and realize that heat is a problem and that it's killing us and increasing hospitalization, so that we need to wake up and do our part. Thanks for that, Dr. Lazaro. Yes, now our question to Lindonne, Dr. Telesford. It seems that the outcome was measured at an individual level or in a particular hospital. So how did you measure temperature and humidity to link it to the outcome?
Okay, so that's a very interesting question. And the first thing I think we need to establish, I know I had just a little bit of time, so I had to go through very quickly. But just to reiterate again that the heat index represents temperature and relative humidity merged. So a formula is applied here. So when you use heat index in the model, it is taken into consideration here temperature and relative humidity together. So I just wanted to establish that. So relative risk really indicates the risk ratio of the outcome happening. So it's not just the individual, but you have to think about it as the outcome happening in a population or a group that is, or individual exposed versus those not exposed. The outcome in this case, you can use data from any other setting. We chose the general hospital because of accessibility and availability of the data, but you can do any other setting and you can disaggregate. So we looked at, for example, all-cause mortality, but you can choose to look at another disease if you wish to, okay? So the model generates here the increased risk, right, relative to those that are not exposed. That is what you're generating here in terms of relative risk, the risk ratio here. So really it's looking at the outcome again, and heat index is a compound meteorological index that takes into consideration, using a formula, both temperature and relative humidity.
Yes,
So this is something that can be done in other
important.
Caribbean countries, along with the methodologies that Dr. Lazaro already presented, what they used in Puerto Rico as well.
Yes, so we can replicate that. Thank you very much. Now, I know they want to close the session and go home, but we must tell you what's coming up in the next few weeks, right? So we're going to put Haley to tell us what we could expect on our next session. And please keep posted by joining the WhatsApp. Thank you. Haley, it's all yours.
Oh, hi everybody. It's good to see you all. If you haven't seen me before, you've definitely gotten an email from me, but my name is Haley Campbell. I'm a project director at the GCCHE, and I just want to share with you Some information about our next section on Tuesday, April 16th. In this session, we're going to be exploring pathways in which climate change impacts air quality in the Caribbean. We'll be hearing from Dr. Andrea Seeley, Dr. Satish Sakamurai, and our lovely moderator from today, Dr. Paula Henry. And the session will be modified by Dr. Hema Babular. So we'll love to see you there next week. And I just want to say another reminder to please complete the post-session survey for today if you'd like to receive CME credit for today's session. We would also just love to hear your feedback about this course and how we can improve it. And lastly, if you would like to receive updates from our planning team, please join our WhatsApp group like Dr. Henry mentioned. This is the best way to stay in the loop throughout the course. We'll be posting video recordings and all sorts of fun videos and articles for you to review. And thanks just for joining us for today, and we'll see you next Tuesday.
Any final word from Dr. Hospitalis? We'll let you have just the final word.
How are you feeling? Hot, hot, hot. Well, tonight was just wonderful, and I hope an edifying and informative and very complimentary presentations from our three folks tonight, and we look forward to seeing you next week. Thanks again, Paula.
Thanks, everyone. You made the day. Bye.